The World Malaria Report by the World Health Organization, WHO, indicates that 88% of global cases of malaria occur in the African region. As malaria continues to have a severe socio-economic impact on population in Africa, children under 5 years of age account for the large portion of the estimated 445,000 deaths around the world in 2016. Malaria is identified as the cause of poverty in most households as it keeps affected people away from their workplaces. Children affected with malaria will also be out of school, thereby affecting their time and ability to learn and build their future. The State Commissioner for Health, Dr. Rotimi Ojo, said the effort of state government towards preventing malaria and other related diseases cannot be overemphasized.
The government of the day believes in the totality of the health of the citizen, and I believe we are not leaving any stone unturned. LLIN, long-lasting society treatments, were distributed across the state. There was a lot of advocacy, sensitization and awareness, and I knew people too were well taught. We had role model mothers, we had community vanguards, we had health educators, we had the net enough in the local government area.
On the prevention and control of malaria, our consultant pediatrician at the State University Teaching Hospital, EXUT, Dr. Olatunde Ogundare, has this to say on diagnostic testing and other preventive measures.
The point of early presentation. If they present early, that means coming to the hospital early. And what makes the diagnosis early? Sometimes in those days we used to have one form of anti-malaria that sells for around 100 naira. With that 100 naira, they will treat malaria comfortably. But by the time we wait and it becomes complicated, that's when it becomes an issue. When one has puddles of water, stagnant water, or even used tires that can harbor water at home, all these are areas that the mosquitoes can actually replicate in. So the more the mosquitoes in the environment, the more the likelihood of the person developing malaria. So use of insecticide treated nets has actually been proven all over the world to be very effective in preventing malaria and even the severe forms of malaria, because if one uses the insecticide treated net, that means that will reduce the contact between the individual and mosquito bites.
Dr. Ogundare added that there was need for preventive treatment for pregnant women to avoid maternal and infant mortality.
Some people come towards the end because they believe that they've been pregnant before, so there is no point. But the truth is that the more they take, the better for them and for the baby. Because if a pregnant woman comes down with malaria, they can have severe forms of malaria because their immunity is reduced in pregnancy. And that's the reason why it's been encouraged that they be given the prophylaxis so as to prevent severe forms of malaria in pregnancy. So I will encourage pregnant women to book early so that they can take enough doses. Before it used to be 2, but now they can take much more than 2 doses.
Some mothers spoke on their knowledge about malaria, how they think it could be tackled, and their perception about government programs on malaria.
When campaign against malaria was on, people were given mosquito nets and were emphasized on how to use them. If you expose yourself to an unhygienic environment, you should be expecting malaria. If the environment is clean, then you will be free from malaria. A clean environment guarantees healthy living. Governments at all levels are doing their best to prevent and control malaria. In the olden days, herbal medicine was used and there are a lot of deaths of children. Government distributed mosquito nets and taught us how to use it, but those who don't cherish it are the ones using it for farming and other things.
If Africa carries the high rate of global malaria burden, then Nigeria is not left out. Therefore, governments at all levels should fight tirelessly to eliminate the disease, so also concerted effort must be ensured by parents to control malaria and bring malaria to BRS minimum in Nigeria and Africa at large. It is also important that insecticide nets are used both at home and schools that operate boarding system. As a healthy society is a wealthy society. Abimbola Adegboyega reporting.